Hello guys, welcome back to my channel Anytime Medicine, and today we are going to continue the last video that we have left off, which is folate and vitamin B12. Before we start, subscribe my channel so you cannot miss my further videos. As we have known of folate compounds, which is folic acid, dihydrofolate and tetrahydrofolate, you can see the structures of folic acid, dihydrofolate and tetrahydrofolate, which is used in pyrimidine synthesis. You can check it out, my video of pyrimidine synthesis. I'll put the link in the description box below, so make sure you check it out before you come here. So folate, where it is absorbed by jejunum, and it has increased demand in pregnancy and lactation. There will be increased cell division because there will be fetus in uterus and it is dividing so fast, so there will be more metabolic demand of folate. If mother get deficient to folate, child will get neural tube defects like spina bifida occulta, meningocele and myelomeningocele, as you can see on the screen, that we are going to talk about more deeply in neurology section of my videos. So folate deficiency is more commonly seen in alcoholics because they have poor absorption in GI and from utilization of certain drugs like phenytoin or trimethoprim or methotrexate. As you can see that folate in GI, it get absorbed by intestine and get into plasma, that is inhibited by phenytoin, and that plasma folate will convert into dihydrofolate, and that convert into tetrahydrofolate with the enzyme dihydrofolate reductase, and that dihydrofolate reductase will inhibit by trimethoprim and methotrexate, and that's how certain drugs can develop deficiency of folate. Next we'll see is vitamin B12 or cobalamin. It is a large complex structure, as you can see in the picture that it has lots of oxygen and hydrogen bond in it, and it can really dissolve in water than other vitamins. It contains cobalt, and which is only synthesized by bacteria. That's why vitamin B12 is found in meats, or you can say the animal products, and it is stored in livers for many years in our body. That's why getting deficient to that is very rare. Vitamin B12 deficiency and folate deficiency is the symptoms is really same, but it is different in folate in one way, because vitamin B12 used in old chain fatty acid metabolism in conversion of succinyl coenzyme A, and deficiency will lead to increased level of methylmalonic acid, which contributes to peripheral neuropathy, and in peripheral neuropathy we'll see the myelin synthesis defect, and this cannot be seen in folate deficiency. That's how it can be different in this only one way from folate. As you can see that fatty acid with the odd number of carbons and branch chain amino acid is converting into methylmalonic acid with the help of propionyl coenzyme A carboxylase, and that methylmalonic acid will convert into succinyl coenzyme A with the help of methylmalonyl coenzyme A mutase with the cofactor of vitamin B12. If we don't have vitamin B12, the methylmalonyl coenzyme mutase cannot do anything. That's why there will be high amount of methylmalonic acid. That's why this is a hallmark of vitamin B12 deficiency, and this cannot be seen in folate deficiency. Further, succinyl coenzyme A will be used in heme or in Krebs cycle. So how we develop vitamin B12 neuropathy? So there is a one syndrome which is subacute combined degeneration. It is a degeneration of dorsal column, lateral corticospinal tracts and spinal cerebral tracts. There is a defective in myelin formation, and this mechanism is unclear. You can see the bilateral symptoms. You can see the more symptoms in legs than arms. Bilateral symptoms like paresthesia, ataxia, loss of vibration and position sense, and can progress to severe weakness or paraplegia with time. Individuals who have pernicious anemia, which is autoimmune disease, in this disease there will be destruction of gastric parietal cells, therefore loss of secretion of intrinsic factor, because intrinsic factor it is synthesized in parietal cells. So intrinsic factor is necessary for vitamin B12 absorption from terminal ileum. If we don't have enough intrinsic factor, we cannot absorb vitamin B12 in our body. There is a chronic inflammation of gastric body in pernicious anemia, and this is more common in women. So if we see the immunology of pernicious anemia, there will be antibody against parental cells and intrinsic factor. This is a type 2 hypersensitivity reaction because type 2 reaction is antibody mediated reactions, and there will be autoreactive CD4 T cells too in our body. Pernicious anemia is associated with HLA-DR antigens that we are going to see in immunology videos, and it is also associated with gastric adenocarcinoma. In picture you can see the normal stomach and the stomach with the carcinoma. So how other ways we can develop vitamin B12 deficiency? Ileum resection and dysfunction, like in Crohn's disease. In Crohn's disease there will be ulceration of intestine, so we cannot absorb the vitamin B12 in our body. Loss of intrinsic factor, like we can see in gastric bypass, because in gastric bypass we cut down the part of stomach, that's why we cannot secrete the intrinsic factor, so there will be loss of intrinsic factor. We can develop by malabsorption in infection of Diphyllobothrium ladum, which is a helminth which transmitted from eating raw fish and which consumes vitamin B12 that we need for our body. We can develop in enterocytitis and excessive alcohol intake. We cannot absorb the vitamin B12. If we take insufficient vitamin B12, like if we have vegan diet, we cannot get vitamin B12 because vitamin B12 most found in animal products. So who have in vegan diet, that can develop vitamin B12 deficiency more often. So how we can diagnose vitamin B12 deficiency? The first is the low serum vitamin B12 and high serum methylmalonic acid, which is a hallmark for vitamin B12 deficiency. We will also see the antibody against intrinsic factor, like in pernicious anemia, and for that we can do also Schilling test, which is a classic test for pernicious anemia. In this test we have to consume oral radiolabeled vitamin B12 and also intramuscular vitamin B12 for saturating the liver receptor. In normal test, we'll see the radiolabeled vitamin B12 in urine. If we don't see vitamin B12 in urine, that means that we don't have intrinsic factor in our intestine and we cannot absorb vitamin B12 in our body. If we do this test with oral intrinsic factor and we'll see the vitamin B12 in our urine, that means that we deficient to intrinsic factor or we are positive for pernicious anemia. We can treat the vitamin B12 deficiency with the liquid injection of vitamin B12, which given subcutaneously or intramuscularly, which shows the increasing reticulocyte because vitamin B12 need for DNA synthesis, like we have talked about in last video. That's why we will see the increasing amount of reticulocytes in our blood. So thank you everyone for watching this video. Do subscribe my channel, share it to your friends, and see you until my next.